Hello, my name is Teshk Shawis. I'm a consultant physician at Colchester General Hospital with special interest in falls in the elderly. Although falls are common among the elderly population, they are not an inevitable consequences of age. Falls in the elderly are usually the result of many causes, hence the phrase multifactorial. However, in spite of being common and caused by many causes, they are preventable. The evidence for their prevention is through many professionals, multidisciplinary input. This video has been produced to share the expertise or our expertise of multidisciplinary team with patients and their relatives to help them to recover from their falls or to prevent them from having further falls in future. This video is specifically for elderly people who attended hospital because of falls or who had a fall while they are in hospital.
Hello, my name is Joanne and I'm a falls prevention practitioner. As part of your admission to hospital, we will assess your risk of falling by asking you 4 questions. Have you fallen in the last year? Are you frightened of falling? Do you have a problem with your gait or your balance? Do you have some confusion or dementia? If the answer is yes to any of those questions, we will start the Falls Prevention Integrated Care Pathway, which initiates a series of actions to reduce your risk of falls. If you feel unsteady or dizzy, don't put yourself at risk. Please ask assistance from a member of staff. Always wear good-fitting footwear when getting out of bed. Staff can provide you with non-slip socks if you require them. If you use them, bring your glasses and/or your hearing aids. Do not be tempted to use other patients' mobility aids, only use the ones issued specifically to you by your physiotherapist. It's really important to keep yourself moving. Follow instructions given by your physiotherapist or your occupational therapist and carry out any individual exercise programs as directed by your therapist. Keep hydrated, always ensure you drink plenty of fluids. Eat regularly and take your medication as prescribed and as given by your nurses. If you happen to fall whilst you're in the hospital, please make sure that you report it to a member of staff just to ensure that you have no injury. From time to time, we may use bed rails and these will help to prevent you rolling or sliding off the bed, but rails cannot be used to stop you from getting up. We might also use a low-rise bed frame and sensor panels which will be used to maintain your safety.
Hello, my name is Amy Anderson and I'm a dietitian. Good nutrition is important for strong bones. Try to maintain a healthy weight and avoid dieting. Instead, aim for a variety of meals, including fruit and vegetables, even whilst in the hospital. The hospital meals are nutritious. Furthermore, the hospital has systems in place to help ensure that you eat and drink well. These include red trays to identify those patients who may need additional support with meals, protected meal times, which ensures you are not disturbed by the staff during your meals, additional ward-based snacks if necessary. 2 of the most important nutrients for strong bones are calcium and vitamin D. Calcium keeps your bones strong and rigid. The main sources should come from your diet. Good sources of this are dairy products, green vegetables, beans and lentils, nuts and seeds, fortified cereals, milk and milk products. Vitamin D is necessary for healthy bones. The main source is sunlight. Try going outside for 15 minutes, 2 to 3 times a week without sunscreen from April to September. Good sources of this are oily fish, eggs, fortified cereals, milk and milk products. As you get older, it is more difficult for your body to manage vitamin D. If you are over 65, it is advised that you take a daily supplement containing 10 micrograms of vitamin D. You could be referred to the dietitians if you are at risk of malnutrition or need specific dietary advice. Dietitians are experts in nutrition and diet to prevent and manage disease. Please inform your nurse or doctor if you have a poor appetite, as this further increases your risk of falls. A healthy and balanced diet, including calcium and vitamin D, is important for healthy and strong bones.
Hello, Hello, my name is Pai. I'm one of the care of the elderly pharmacists in Colchester General Hospital. Today I'm going to talk about what pharmacists can do in terms of falls prevention. So it is believed that if you take more than 4 different medicines, it can increase the risk of having a fall. Some particular medicines are associated with an increased risk of falls due to their side effects. For example, sleeping tablets, painkillers, heart tablets including water tablets, and some other medicines for mental health conditions. Hospital pharmacists review the medications at various stages during admission, including when you firstly admit to the hospital, during admission, and on discharge. On admission, hospital pharmacists establish the medication history, making sure what you were taking before the admission are matching up with the prescriptions written in the hospital. We also identify high-risk medications and prompt the doctors to review the medications according to your need and response. We monitor the patient and review the medications accordingly. In some cases, we do restart medications according to the patient's need if it is safe to do so. Bear in mind though, some medications may be stopped during admission. On discharge, we make sure a patient has at least a supply of 7 days worth, and we also supply a medication record card to list out all the medications that the patient should be taking. A discharge letter will also be given containing important information about the discharged medicines. For example, what exactly has been stopped and why it has been stopped. So here are a couple of take-home messages. Medications are reviewed on admission, during admission, and on discharge. It is likely that some of your medications are stopped or withheld temporarily if you have had a recent fall. Thirdly, information regarding your discharge medications is available on your discharge letter, which your GP will also receive a copy when you are discharged from the hospital.
Hello, my name is Rebecca. I'm one of the physiotherapists here at the hospital. Physiotherapy helps restore movement, function and independence after injury and falls. They will work with you on functional movements, getting up from a chair, walking, and looking at posture and balance, and any particular areas that are painful or stiff. The physiotherapist will advise you on important exercises to do to improve your balance and strength. As we get older, our reaction times get slower, but research shows that we can improve our balance with simple balance exercises. Also, between the ages of 50 and 70, we lose about 30% of our muscle strength, and this can continue into older age. Muscle strengthening exercises help to maintain our independence and keep us stable. Also, bones naturally become more brittle as you get older, and this increases the chance, unfortunately, of breaking a bone if you do fall again. Weight-bearing activities can help to improve bone strength. Some people get so worried about falling that they restrict their movement and spend long periods of time sitting down. This harms balance, strength and mobility, which in turn makes you more likely to fall, and it's a bit of a vicious circle. You sit for longer periods, you get weaker, and then you're more likely to fall. So physiotherapists will help you to stay positive and take small steps to keep you moving. They can practice relaxation exercises with you for when you are anxious. Maximising your independence is really important. Our feet, for example, change shape as we age and lose some feeling and flexibility, and these are after all what we stand and balance on. So taking care of your feet and nails and wearing good, well-fitting supportive shoes and slippers can help. Walking aids can be a useful tool. They help you improve your confidence and mobility, so don't be embarrassed to use them as they help you stay steady and keep you moving. As you improve, you may find you no longer need to use it. It is important that it is the right height for you and is in a good state of repair, especially the rubber ends on the bottom which stop sliding. The physiotherapist will assess you to recommend the best walking aid for you. It might also be worth thinking about what you would do if you do unfortunately fall over again. The therapist can discuss the best ways you might try to get up from the floor after a fall if you are unhurt, crawling to the bottom stair for example to help you up. They can also discuss a plan as to how you might get help, perhaps using the care line button, and what to do whilst you wait for help to keep you warm and comfortable. If needed, once you go home, we can refer you on to the Community Falls Prevention Services. These are provided by our partners, Anglia Community Enterprise. They work closely with GPs and other health and social care professionals out in the community. They can visit you in your own home to check that you're all well and settled, and can continue to help you to make further improvements in your balance, strength and confidence, either with exercises at home or in one of our community exercise groups.
It's inspiring me actually just to keep going basically. Get a lot of support from the team here and I look forward to coming.
Hello, my name is Tracey Williams-Macklin. I'm an occupational therapist. Occupational therapy enables people who have had a fall in order for them to improve their safety and their independence within the home environment. We look and work with individuals to have practical solutions in order to overcome any barriers that the fall may have created. We look at everyday activities, and they are activities that you carry out within your home, and we look at those activities that will create a risk or the environment that could potentially create risk for you. So we work with you to find solutions that will best enable you to feel comfortable in doing those activities and get that independence back. So the general safety things that we will be looking at with you is around making sure you have emergency telephone numbers nearby, access to cupboards, switches, looking at the environment around the floor, the stair treads, the carpets. We will be that fresh pair of eyes so that we can work with you to identify any area that could be improved upon, either by looking at equipment or changing the way you do activities, or just talking through what are your concerns, especially if you've come into hospital and you've had that fall and you need to go back into that environment. So we will work with you to help you overcome some of those barriers, along with other professionals, around the fear of falling. And we were really keen to keep you active, like the other professionals will. And we will do this in a methodical way by looking at each room that you have within your home. So we look at the access to your property, your stairs, your bathroom, your kitchen, your bedroom, outside, garden. And we will have an overview of what's going on and work with you in your home.